Hello, my name is Layan Suleiman, and my undergraduate partner on this project is Ying Wu. We spent fall of 2023 working under Professor Terlaki and Mohammed Hussein on optimizing treatment planning for proton therapy. To begin, proton therapy is primarily researched and utilized for the purpose of cancer treatment. Cancer treatments have been continuously evolving as scientists work to maximize effectiveness and minimize side effects. The Royal College of Radiologists estimates that approximately 40% of cured cancer patients were treated with radiation therapy. There are two methods of administering this to cancerous cells. The first is X-ray or photon, and the second is proton. Proton therapy specifically is a type of radiation therapy that delivers proton beams to target cancerous tissue. The goal of optimizing this type of treatment is to maximize the dose received in the tumor, minimize exposure to healthy tissue, and reduce side effects for the patient. In order to achieve this effective and efficient treatment plan, real patient data is utilized to develop usable simulations that allow for case-specific optimization.
Proton radiation therapy can be applied as intensity modulated radiation therapy (IMRT), which breaks up the proton beams into smaller beamlets. The intensity of these beamlets can be optimized to target specific organs. This allows for a more precise treatment plan than traditional radiation treatment, resulting in less radiation exposure to healthy tissue, as well as fewer side effects and faster recovery time. The difference between this method of treatment and photon therapy is small, but the effects can be immense. Proton and photon therapy are both very common methods of treating cancerous tissue. Despite these techniques, both being different types of radiation therapy, the benefits and challenges of each are very different. Proton therapy allows for targeted delivery of proton particles to tumors, whereas photon therapy causes significantly more harm to healthy tissue and critical organs surrounding the cancerous tissue.
There are many components that are included in the process for optimizing treatment plans for patient-specific cases. The objective function of this optimization problem works to maximize the dose received in the tumor, while constraints limit the dose received in healthy organs, placing more weight on critical organs. The variables represent the intensity of each beamlet, which is solved to maximize the objective function while staying within the limits of the constraints.
The way we can accomplish this can be divided into three main steps. First, the utilization of real patient data from the Oncology Center at the University of Pennsylvania allows for case-specific treatment plans that can be easily modified and applied to similar cases. Since cancer cases and treatments are far from uniform, it is difficult to generalize a treatment plan or strategy for all patients. The real patient data allows for more accurate planning. The specific data received for the purpose of building treatment plans encompasses three main organs: the heart, the lungs, and the esophagus. The second component of optimizing a treatment plan is to utilize MATRAD, a MATLAB-based treatment planning system, to combine optimization outputs and analyze how the plan can be applied to patient cases. The final component of planning process is treatment optimization, in which linear optimization formula is utilized. First, data is imported, variables are defined, a model is built, and an output based on the specified constraint is observed.
Still, proton therapy is not a perfect solution. We are faced with some challenges. The most pressing challenge is that optimizing proton therapy treatments includes very complex models, since there are so many variables. Since the treatment plans are case-specific, it is very time-intensive and expensive to develop these optimized plans. Additionally, proton therapy is very sensitive to movement in the body as the treatment is administered, since it is designed to specifically target cancerous tissue, so any movement could alter the target position. Future research will focus on improving the implementation time in order to drastically reduce the time it takes to actually develop a treatment plan, as well as improving the treatment plans so they can better address things like body movements, perhaps allowing for more wiggle room in the beamlets while still targeting the cancerous tissue. And with that, we'd like to extend our gratitude to the Department of Industrial and Systems Engineering, more specifically the Outreach ISC Research Program, as well as the Oncology Center of the University of Pennsylvania for providing the data necessary to make these advancements possible.